Well, the Seton healthcare network across Central Texas, 11 hospitals and clinics, realized they were seeing far too many of the same people turning up at their emergency rooms, costing taxpayer money and overburdening the system. So they've been doing something about it. Their approach is a first in the nation, and it's working. They launched a system-wide computer high alert program, identifying those they call ER superusers. An average visit to an ER costs $2,500, and if you're a regular, it adds up. Why is an ER visit so expensive? Well, if they don't know you, if they don't know your case history, they are obliged to do a full workup on each and every patient. Seton identified 5,000 super users system-wide. Most commonly, they are addicts, suffer migraines, or are homeless or mentally ill. They are now permanently listed in the computer bank.
I don't think very many of them want to be abusers of the system. I think a lot of folks don't have other resources, or they do but they don't know what they are, or for whatever reason they prefer this environment to another environment because they feel that we've treated them different or better.
They can divert those super users to more appropriate clinics, or at least target their treatment without the great expense, cutting down on some of the high-cost specialty scans. It's been working, and most super users don't seem to mind.
You may know that for you this particular medicine works best, so rather than having each random doctor use their favorite drug, how about if all the doctors give you the drug that works best for you at the dose that's effective?
Thanks to High Alert, super user visits and costs are way down. And for the patients, often the disabled, there's an added bonus of getting benefits coverage.
We've actually succeeded now in getting some people signed up for things like Social Security and Medicare that would never ever get that in any other community, even though clearly they should qualify for it by the nature of their illness.
Now, the High Alert system has been such a success this past week, Seton shared it with medical executives from around the country in a national conference. Taking a closer look for you now at the Seton High Alert success, the Brackenridge ER alone has seen 66,000 patient visits the past year. With High Alert, they've reduced super user visits nearly in half, cutting them 48%. That comes out to an annual savings of $8,500 per year among the super users.